Basic principles of instrument utilization for tooth removal procedures. The purpose of this program is to demonstrate the proper use of the number 2 Molt curette for detaching the mucoperiosteum from the necks of the teeth, the proper application of the number 301 elevator for tooth luxation, the proper application of the beaks of universal tooth removal forceps number 150 and number 151, the luxation movements and the forces that are transferred to the roots of the teeth and the alveolar processes of the maxilla and mandible during tooth removal, and the step-by-step procedure for the removal of each individual tooth in the maxillary and mandibular arches. In order that the viewer might better visualize the transferal of forces required in tooth removal, models simulating the adult maxillary and mandibular arches are utilized in this demonstration. For the purposes of this demonstration, the equivalent of the labial and buccal surface mucoperiosteum and the underlying cortical and alveolar bone have been removed from the model. Prior to starting any tooth removal procedure, it is essential that the operator visualize, from radiographs and from his knowledge of dental anatomy, the anatomy and shape of the root structures of the tooth or teeth to be removed, and the anatomy of the adjacent tissues. The operator must keep in mind the relationship of the teeth involved to the maxillary sinus, nasal fossa, the lingual nerve, the mental foramen, and the mandibular neurovascular canal. When undertaking multiple extractions, it is best to start with the posterior teeth and work toward the anterior portion of the mouth. It is also advisable, when extracting maxillary and mandibular teeth, to extract maxillary teeth prior to mandibular teeth. Hemorrhage tends to accumulate in the posterior region of the mouth. If you begin in the anterior region, this may obscure the surgical field in the posterior region. Secondly, extracting maxillary teeth first prevents debris such as sections of fillings falling into mandibular sockets. A sharp number 2 Molt curette is first used to check the depth of anesthesia. When the anesthesia is profound enough, the curette is slid around the crown of the tooth inside the free gingival cuff in order to sever the gingival attachment of each tooth to be extracted in that quadrant. This is done first in the buccal or labial surface and then on the lingual or palatal surface. The next instrument utilized is the number 301 elevator. The elevator is placed interproximally with the cutting edge against the tooth to be extracted. Pressure is then exerted against the tooth to be removed. The operator must avoid placing any pressure against the adjacent tooth if it is not to be extracted. The elevator is then rotated to bring the cutting edge of the elevator into the tooth to be removed in such a manner that the instrument rotates from the apex of the tooth toward the coronal portions of the tooth. When the tooth has been luxated, that is, moved and or elevated from the socket, the instrument is laid aside. Forceps are held near the ends of the handles in order to obtain the maximum mechanical advantage. In the application of the forceps, it is essential that the long axis of the forceps be placed parallel with the long axis of the tooth. To properly seat the forceps at the cemento-enamel junction, pressure is placed toward the root apex of the tooth. Once the forceps is properly seated, enough pressure is placed on the forceps handles to hold the forceps on the tooth without their slipping. It should be noted that unnecessary pressure will fracture or shatter a weak or cariously undermined tooth. When placing the forceps, the palatal or lingual beak is placed first, followed by placement of the buccal or labial beak. The first tooth to be removed is the maxillary second molar. The second molar has 3 roots, 2 buccal and 1 palatal. With this in mind, apply the beaks of the forceps as previously described. The palatal beak first, and then the buccal beak, with the long axis of the beaks parallel to the long axis of the tooth. When the beaks are properly seated, grasp the forceps firmly at the end of the handle and push toward the root apex in order to establish a firm grip on the tooth. The first movement is to the buccal. The next movement is downward and palatal to avoid driving the palatal root into the maxillary sinus. The buccal movement is then repeated more forcefully. The tooth is then subjected to slight mesiodistal rotation to enlarge the alveolar socket. This is followed by a downward and slightly rotating movement to allow the tooth to find its own path of removal. To better visualize the motions applied with the forceps, the demonstration will be repeated from an anterior-posterior perspective. For the maxillary first molar, the application of force is the same as with the second molar. However, a little more force is required on this tooth because it is normally a larger and stronger tooth and is located in an area of the maxilla where the bone is thicker and more firm. Remember, excessive pressure and rotating movements on multi-rooted teeth will, in most instances, fracture them. Place just enough pressure so that you can feel the tooth moving in the alveolar socket. Next to be removed is the maxillary second bicuspid. This is usually a single-rooted tooth. After the forceps are seated at the neck of the tooth, the first movement is to the buccal side. This is followed by movement to the palatal side. A slight mesiodistal rotation and downward movement and delivery. The maxillary first bicuspid is a double-rooted tooth. Again, the first step is to properly seat the forceps and gently push up into the socket. The next movement is toward the buccal, then toward the palatal side. This is followed by a downward movement in the long axis of the tooth, resulting in delivery of the tooth. At this point, it is important to note that this series of movements may need to be repeated several times before the tooth is delivered from the socket. The motions are repeated when the alveolar bone has to be expanded in order to free the tooth from its bony socket. The maxillary cuspid has a long, conical root. After the forceps have been properly seated and the tooth slightly pushed up into the socket, the first movement is to the labial side. This is followed by movement to the palatal side and mesiodistal rotation. Once again, movement to the labial, palatal, and then rotation repeated a little more vigorously. This is followed by downward movement in the long axis of the tooth. In multiple extractions of a quadrant, it is recommended that you first remove the second bicuspid, then the lateral incisor, followed by the cuspid. This allows for easier removal of the cuspid, which is located in an area where the alveolar bone is firm and thick. This tooth is very thin mesiodistal. Because of this, the operator should avoid rotating this tooth if possible. The first movement for removal of this tooth is to the palatal side. then to the labial side, and finally a downward movement and delivery of the tooth. For the central incisors, the procedure is much the same as with the laterals. First, movement to the labial side, then to the palatal side, followed by a rotary movement from labial to distal, and then rotary movement labial to mesial. The final movement is downward, while gently luxating in line with the long axis of the tooth. The mandibular model has also had the mucoperiosteum and the underlying bone removed. Again, the student should note that this has been done for demonstration purposes only. The bone of the mandible is denser and firmer than that of the maxilla. As a result, the teeth are more firmly supported by the bone. Also, the mandible pivots on two hinges, the condyles, which are attached to the skull by tendons, muscles, and ligaments. Consequently, the mandible must be supported during extraction movements to avoid undue stress being placed on the soft tissues supporting the mandible. As previously indicated, in multiple tooth removal procedures in one quadrant, start with the most posterior tooth and work toward the anterior teeth. The luxation movements for the first and second molars are similar, the only difference being that the first molar, being a larger tooth with more pronounced root structure, will usually require more force in its removal than the second molar. The use of the number 2 Molt curette and the number 301 elevator is the same as demonstrated in the removal of maxillary teeth. For the extraction of the first and second molar teeth, we will employ the number 151 universal lower forceps. The number 23 or number 16 cowhorn forceps may also be used for the removal of these teeth. The luxation movements with either of these forceps is the same, but the placement of the beaks is different. The beaks of the number 151 forceps are placed below the mucogingival cuff, with the lingual beak placed first, followed by placement of the buccal beak. They are designed to engage the anatomical neck of the tooth. For the cowhorn forceps, number 16 has a curved handle, the number 23 a straight handle. Place the lingual beak at the lingual bifurcation, followed by placement of the buccal beak in the buccal bifurcation. Make certain the mandible is properly supported before initiating the movements for tooth removal. The first movement is to the lingual side, followed by movement to the buccal. Repeat these movements several times and apply moderate mesiodistal rotation. This is followed by an upward motion in line with the long axis of the tooth. This should be done gently and slowly to prevent forceps hitting against the maxillary teeth when the tooth is finally released from its socket. Next are the premolars or bicuspid teeth. Luxation movement of these two teeth is identical. After applying the beaks of the number 151 forceps in the proper manner, the first movement is to the lingual, then to the buccal. Then apply rotary movement mesio to buccal and then disto to buccal. The final movement is upward while gently rotating in line with the long axis of the tooth. The application of the beaks and the luxation movements are the same for each of these three teeth. The cuspid is a larger, more firmly embedded tooth and requires more force than the incisors. The first movement is to the labial side, followed by movement to the lingual side. This is followed by slight rotation and upward movement in line with the long axis of the tooth. To review, the successful removal of teeth depends upon an understanding of dental anatomy, The proper use of the curette in detaching the mucoperiosteum from the necks of the teeth. The proper application of the elevator for tooth luxation. The proper application of tooth removal forceps, and the application of proper force and motion to the tooth being removed. The removal of teeth requires a systematic, considered approach to each tooth being removed.